California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Hi, my name is Dr. Eric Ball. I am a primary care pediatrician in Orange County, California, and welcome to California Pediatrics, where we discuss topics of interest and spotlight on the professional trajectory of our guests.
And I'm Melissa Ruiz. I'm an outpatient general pediatrician, and our guest today is Dr. Ben Hoffman, and we'll be discussing his origin story as well as advocacy and product safety. Dr. Hoffman, thank you so much for joining us today.
I'm so excited to be here. Thanks.
I'm so excited for you to be here because I think you came and spoke to us about a year ago at my program, and we are actually going to be starting an advocacy health institute called CAPE because you spoke to the superhero that pediatricians are. So I really wanted to hear your origin story, as I alluded to.
Great. So I come from a family, an interesting family. My step-grandfather was a pediatrician, was the first child health commissioner in New York City back in the 50s, and then went to work for the World Health Organization. And the entire time I knew him was working in maternal child health in Africa and Southeast Asia. My dad's a physicist, and the marriage of child health and science sort of led me to pediatrics. I went to college thinking I wanted to be a pediatrician. I also had a pediatrician growing up who I absolutely just loved and admired. Met my wife in college. We did med school together. She's a pediatrician as well, and we trained we did our residency training in Seattle between 1992 and 95. During medical school and residency, we had an opportunity to work on the Navajo Nation with the Indian Health Service, and absolutely positively fell in love with it. And when we were done with training, knew that we needed to go back and work on the reservation. And so we did. And so we spent 4 years living in a place called Gallup, New Mexico, on the eastern end of the southeastern corner of the Navajo Nation. And it will always be, without question, the best job we ever had.
So you're known throughout pediatrics as being an expert in product safety and injury prevention. So how did you get started in that? How does one get interested in such a thing?
There's no universe in which I ever imagined I would be the car seat guy. Part of our responsibility in the hospital in Gallup was doing consultation to the emergency department. I mean, it was a super crazy, super busy place. We were on call one night a week and 1 weekend a month, and it was pretty likely when you were on call you weren't going home. Mm-hmm. The first winter we were there, the winter 1996, 1997, I got called in on 5 straight call nights, so basically 5 nights in a month, to help stabilize a kid who'd been critically injured in a car crash, none of whom were restrained at all. And I remember standing, I know exactly where I was, in the emergency department after the 5th one, just mad as hell, and saying, somebody needs to do something about this, and realizing I have no idea how to do anything about this. I realized I knew nothing about car seats. I just finished residency. We had a daughter. I knew I hated our car seat because I didn't know how to use it, but I couldn't even remember a single lecture. I certainly didn't know how to interact with the community to affect change. I didn't know what the state law was. I didn't know what AAP policy was on car seats. And for some reason, that 5th time led me to sort of overcome the activation energy necessary to bridge that paralysis of the infinite, this problem that's just so big and so complex that we don't feel we're prepared for or that we have the agency to address. And I needed to do it. The next day, post-call, I got on the internet. This was pre-Google, so it was Ask Jeeves or Netscape or something like that. And I started looking into things, and I found the AAP policy statement on child passenger safety, and there was a name that kept coming up over and over and over as I started going down a rabbit hole around the literature, and it was a pediatrician at Riley Children's in Indianapolis named Marilyn Bull. And so it seemed to me she was the person. So I found her email, and at like 3 p.m, I sent her an email, and 3 minutes later, I get an email back saying, "Here's my phone number, call me." And I did. And she became the most incredible, kind, supportive mentor to me in that space. Somebody who'd never met me. I basically wrote, "Hi, I'm this dorky pediatrician in the middle of nowhere. I want to talk to somebody I want to learn about car seats." And she just hooked me up. She connected me. She told me that in my state, there was going to be some group that did training to teach people to become car seat technicians. There was some group who was going to be doing assessments for seatbelt and car seat use. There's some group that's going to have a distribution program and an education program to work with communities. And it turned out that group was all one nonprofit based in the state capital in Santa Fe. And my next call was to them. And their response was, "Oh my God, you're a pediatrician and you're in Gallup. We love all of those things, both of those things so much. Can we meet with you?" And that led to my becoming certified as a car seat technician. It led to my developing some expertise in terms of how to do assessments around seatbelt and car seat use. And it led me to start to build relationships with the community just by identifying who would be interested in talking about this. And long story short is that 3 years later, 3 years after that initial night, we had a training in Gallup and trained 27 community volunteers to be car seat technicians, a number of law enforcement, community health workers, fire EMS, educators across the spectrum. And we partnered with the mayor and the guy who was the publisher of the newspaper and the man who owned 4 radio stations in English, Spanish, and Navajo, collaborated with Walmart, which at that time was the second busiest Walmart in the universe. Wow. And in the span of a year, doubled car seat use rates in the community. And it was us.
It's amazing.
And that absolutely positively changed me.
Yeah, I mean, hearing that, kind of the trajectory of it, what struck me is that like 3 years later, right? Because you like had to start in that first like cold call email, and then the next cold call email, and then it takes time, and I do think that feels overwhelming often to people who want to work in this space, especially residents who are like, I only have 3 years, but remembering that you don't only have 3 years. And I think I'd love to hear kind of how that has, evolved into kind of the work you've done since that time.
Yeah. So that piece, I knew that what I was going to be able to do in it. I'm a general pediatrician, as are both of you. I knew what I could do in an exam room or at a bedside, right? Education, resource allocation, resource awareness, that sort of stuff. Absolutely essential, right? Really important, but one at a time. And, it doesn't get to the root causes of the problem. What I learned in doing that community engagement work was that we can leverage our expertise and our passion and our skills and do what we do every single day: build relationships with people, have conversations, and advocate for things and convince them to join us. I mean, we do that with patients with strep throat all the time. But I saw the power of being able to move outside of that traditional clinical relationship and upstream a little bit in terms of prevention, and realized, again, I knew pediatricians. I'd had attendings and mentors in residency who were doing some of that work, but they never taught us how to do it.
Right.
And I got really fascinated about that. In 2000, I decided I really missed teaching, and I wanted to get back to being an educator. And I took a position at the University of New Mexico in Albuquerque, about 150 miles east of where we had been in Gallup. And part of what I wanted to do was teach residents what I wished I had learned about community engagement. At that time, I had grown up in New Mexico. This was in 2000. The last time I had been in the capital in Santa Fe was my 4th grade field trip in 1978. And I got an email from folks at the nonprofit who did the car seat training and that's a nonprofit called Safer New Mexico now. I got an email from them saying that they were building a coalition to address the child passenger safety law in New Mexico, the car seat law, which was a terrible law. It only required car seats up to the first birthday. And then a seatbelt was okay after that. And then if you were 12 in the back seat, you didn't need to be in anything. You were free to be a projectile. Terrible law. And they asked me if I would be willing to join that coalition and work to pass that law. And I said, sure, that sounds great. I have no idea what any of that means and how to do it. But they had people who did,
Yeah.
and they brought me along on the ride. They asked me to go provide testimony at the Capitol. So I walked into the Capitol in January of 2001 for the first time since 1978, and told a story. And the response from the chair of the Transportation Committee of the House of Representatives was, oh my God, how come you didn't tell us about this sooner? And it passed unanimously, and then, it was amazing. And that added then this layer of, this other layer of advocacy from the community engagement work to this bigger systems and policy change stuff. And so I integrated all of that into trying to think about how to put together a curriculum for residents, got connected to other people around the country who were doing that work. A lot of them are actually here in California, and I continue to call them mentors and friends, and to this day. I learned a lot from them, and that gave me the opportunity to think about building a curriculum and working on training the next generation to be the pediatricians that kids and families and communities really need.
Yeah.
So you mentioned when you went to the Capitol, you told a story. You didn't say you gave them the data. So can you talk about the power of stories and how that affects us with advocacy?
So I did talk a little bit about the data, framing it in terms of leading cause, at that time, single leading cause of death for kids and the stats in New Mexico and all that sort of stuff. So I told the story about, right, I told a little bit about my origin story that I just did with you about how I became passionate about this, about how New Mexico's kids do better. And the story I told was a visual story. My youngest son in the summer of 2000, in the summer of 2001 was 11 and a half months old. Sorry, this was April of 2001. He was 11 and a half months old. So I took a picture of him in our minivan in a seatbelt. And he looked ridiculous, as you can imagine. Yeah. And I went to someplace and got it blown up, and I held that up. And I said, in 2 weeks, this is legal. And that's when the chair said, oh my God, how come you didn't tell us about this sooner? I could have gone into the data and the science and all of that. That doesn't make people feel things. Yeah. A lot of advocacy is around getting people to feel things. Yeah. And we can do that.
Absolutely. The power of story. I'm going to pivot a little because I'll tell you a story. So, because I want to talk a little bit about the product safety work you've done. My youngest came home from the hospital in March 2018. Someone said, hey, the rock and play is like the best thing. And he had a little bit of reflux, and we put him in it, and he slept so well in that thing. And I loved it, and it was amazing. And then I passed it on to a patient about 6 months later, and I think March of 2019, it got recalled. So how, as a pediatrician, could I have done better? And what is that? How do we know more?
Yeah, that's a great question. So I knew nothing about product safety either. Part of my journey has been through initially mentorship with Marilyn Bull, connection to the American Academy of Pediatrics Committee and Section on Injury, Violence, and Poison Prevention, now the Council on Injury, Violence, and Poison Prevention. And she sponsored me to a position on the National Nominating Committee, which got me an opportunity to meet a bunch of folks and get plugged in and develop relationships. And over time, that led to an opportunity to be on the executive committee, serving a bunch of other roles, and then to be on the executive committee, and then to be the chair of that committee. writing and developing and writing policy that guides best practice based on the best available evidence. One of the roles that the chair of that council has is providing annual testimony to the priorities hearing for the Consumer Product Safety Commission. And so I had a chance to do that and got to meet the folks at the Consumer Product Safety Commission. And because of that, those opportunities, when the rock and play thing went down, I was positioned. I was in the position to be the spokesperson, and had a relationship with the product safety community because of the Consumer Product Safety Commission stuff. And so I just sort of lucked into that. Again, another thing I never thought I was going to be involved in. And the simple answer to your question is that in 2018, there was no way to know.
Oh, I feel bad.
Many of us would have looked. I can tell you that the first time I ever saw a rock and play was in November of 2016. A friend who's a transplant surgeon, not a pediatric surgeon, and his wife had a baby, and when they were brave enough to finally come over so we could feed them, they schlepped over the whole thing, and one of the first things they did is unfurled this rock and play in the middle of my living room, and I looked at it and said, "What the hell is that?" And he said exactly what you said. "This is a rock and play. It's like the greatest thing. Everybody loves it." And I said, "No,
It's too cozy.
You can't. Like, there's no way. Babies are not supposed to sleep at an angle. You can't. Please don't use it." And I convinced him to destroy it. We destroyed it.
Oh.
And so once it came, so this was something, once I knew about it, I couldn't not know about it. And everywhere I went, this thing just drove me crazy. And it wasn't until I believe it was April of 2019, there was the Consumer Product Safety Commission issued a warning about the rock and play and noted that there were 10 deaths that they were aware of. And the next day, a Consumer Reports article came out documenting that there actually were 32. Which even was that was also not a complete list, but it was just this idea that, oh, okay, well, there may be a problem. There's 10 deaths. No, there's actually 32. It really uncovered this flaw in the way that we know what we know. Like that, there was data there was knowledge that showed that this thing potentially was dangerous, this product, and there were rules in place in the Consumer Product Safety Commission that prohibited them from disseminating that information.
Oh, wow.
And the reason that the Consumer Reports reporter knew differently is that she had put in a request, a Freedom of Information Act request, and somehow got unredacted data that told the truth of the story.
So as a pediatrician, my kids are older now. Sometimes I go to the store just to see like what the new products are, but very often parents are like, my kid is sleeping in this product and they play in this thing, and I don't know these things anymore. So do you have recommendations of how a pediatrician can stay abreast of what's out there, what's safe, what's not safe?
I think talking to patients and families, that's how I learn a lot. As a car seat nerd, I regularly will walk through like stores just to see. It was a lot easier when there were a lot of baby stores that don't exist anymore. It's a lot harder to stock on Amazon or other mass market sellers online. And I think because I'm connected to the community now, I think I have a different perspective. It's really hard. And part of the challenge is anybody can bring something to market and sell it. And unless it's something that is already regulated, the onus on us is to prove that it's harmful. There's the assumption that it's safe until proven unsafe, as opposed to the other way around where you have to demonstrate safety. Car seats are regulated very tightly by the National Highway Traffic Safety Administration, and they cannot bring a car seat to market unless it has crossed all the T's, dotted all the I's, checked all the boxes, gone through all the crash testing, et cetera. Sleep products are not. We're sitting here in California, the Wild West.
I do think your point about you knowing in 2016, I wish I had brought it over to your house, that it was not the right product kind of goes back to some fundamentals though. And I think that idea that like, if we know some fundamentals, like babies need to be flat, babies need to be on a firm surface. Like, I know that, like I knew that. I told myself other things, but I do think kind of going back to some of those fundamentals can be helpful. I mean, I think, I don't know if you help that when we talk about what we can tell parents,
Right. I think going with what we know and giving the best possible advice, I think trying to avoid the perception or the self-belief that we know the absolute right answer and that we always know the right thing to do. Infant sleep especially, that's the hardest thing. I mean, you're both parents. You're probably, as I am, still scarred from those experiences. It's one of the hardest things you'll ever do. And, something that comes to market that promises longer sleep, better sleep, is going to appeal to people. I think part of what we need to realize is that just because it's there doesn't mean it's a good idea. And recognizing that the overwhelming likelihood is that a product that has just come to market has not demonstrated, it doesn't have a demonstrated safety record. And that if it promises something too good to be true, it probably is. I mean, this is cough and cold medicine. This is, incline sleepers. There's tons of stuff that's like that. The products that claim that they are safe, they make bed sharing safe for parents who want to bed share.
Right.
They're making these claims with no science behind it and just a desire to win the market.
Yeah.
I think that's a really good point. So when in doubt about a product, just go back to the basics. And if it really violates those core tenets of safety for a child, you need to be extra cautious.
Right. The Consumer Product Safety Commission tracks stuff very closely. The American Academy of Pediatrics tracks stuff very closely, going back to our policy statements on infant safe sleep and on other things on drowning prevention and all of this. A lot of the products are mentioned, not by specific name, but categories and that sort of stuff. And there's there's always an opportunity, especially for pediatricians, to reach out to your peers, to talk to folks on the who are in the trenches dealing with issues of product safety or firearm injury prevention or whatever. I mean, people who are nerds about stuff do it because they love it and they love being able to share and being able to help.
Do you have, so we have a lot of younger pediatricians, trainees who watch this or listen to this podcast. Do you have any recommendations for them to start? So, you're in the ER, you're seeing your fifth straight night of kids coming in. Like, how did you get motivated to send that email, to make that phone call? How do you even get, so you have this daunting problem of like car accidents and deaths. Like, that's a huge thing.
Yeah.
How do you start?
I think you start because something finds you that's important enough that makes you go, I got to do this. And I think there are a lot of people, there are a lot of pediatricians who are researchers who had some problem that came to them. And I can use my brother as an example. He's a pediatric pulmonologist. His focus is on microbiome in kids in CF, specifically gut microbiome. And his work to improve the health and the lives of these kids and young adults with cystic fibrosis by improving their intestinal microbiome is his advocacy. He feels as strongly about that work as I do about the work I do in child passenger safety. The difference is this, that his passion and his advocacy fits neatly into the bucket of what an academic pediatrician is supposed to do. And he gets credit for it. He gets, he publishes papers, which brings in a lot of credit. He brings in tons of grants. So that works. My work is out in the community. And I'm not billing, coding, and I'm not billing when I'm doing that. Unless I get a grant, and that money has always been hard to come by, it's hard to cover it. So I do a lot of it as, a lot of us who do community work and policy advocacy do it as volunteers. And so you have to be committed to it. And I think part of my passion in the education around advocacy training is really trying to shift the narrative and have the system understand and recognize the value that we are bringing to improve the health of communities, of kids and families and communities, as opposed to just delivering widgets of healthcare that we can bill. I think for the trainees, it's really, I mean, I know that the single most important thing to people applying to pediatrics is advocacy in 2025. I think we need to come to a consensus understanding of how we define that and what that really means, and recognize that during training, the most important thing is to become an amazing pediatrician. In the same way that means even if you're never going to do neonatal resuscitation again, that you become really good at doing neonatal resuscitation in residency. There are skills that are necessary and transferable in terms of how you think about a sick kid or taking care of a child who was a premature infant, that sort of thing. There are skills around advocacy, community engagement work, and systems and policy change work that I think are also just as foundational for any pediatrician. And so attacking your pediatric training from the standpoint of, I need to be the best pediatrician I can be, I need to just learn how to think to the great, I need to learn how to think like a pediatrician, and I need to be prepared with the skills so that if I find myself in an emergency department at 2 a.m. in Gallup, New Mexico, that you're prepared. There's a lot of tension between learning skills and doing the work, especially in training. And I would just urge residents to just play the long game,
Yes.
right? Wait for the thing to find you. It might find you in residency. And I know I've worked with a number of residents over the years who have done incredible things while they were trainees. But if the best thing you do is as a trainee, then we've lost.
Yeah, thank you. That's a great point. I think playing the long game when you're thinking about this, and even as an early career physician, playing the long game, I think that's awesome. Thank you so much for taking the time today. We really appreciate you being here today and speaking with us.
This was fantastic. Really appreciate it. And this is about California pediatricians. And even though you live in Oregon, you are a Californian at heart, right? Where'd you go to college?
UC Berkeley, go Bears.
Well, thank you so much for joining us. Appreciate it.
This has been a thrill. Thank you.
Thanks.
That was a great conversation. It's one of my favorite people to talk to, absolutely.
Dr. Hoffman is always so inspirational and really gives me a lot of hope for the future of pediatrics.
Absolutely. I mean, who doesn't want to be a superhero pediatrician? And I mean, whenever I talk to him, I'm like, I am a superhero. This is amazing.
Yeah, and it makes me realize that, we see a lot of things every day that really frustrate us, and it's really good to hear a story of someone who took those frustrations and put them into action.
Yeah, I mean, that's how you're going to prevent the burnout.
Yeah.
Yeah.
And not to have your baby sleep in a rock and play.
I know. I've learned. Go back to the fundamentals. I think that's, I think the idea of going back to the fundamentals of what we know.
It's a really good point, because often patients will bring things to me and say, do you think this is safe? And I look at it and that little part of my pediatrician brain says, that doesn't look like a good idea. Yeah. And so I really need to kind of trust that and trust the fundamentals.
Yeah.
But thank you for a great conversation today. And thank you all for joining us today for our podcast. We appreciate you tuning in, and we look forward to seeing you on the next one.